If we catch prostate cancer early, the prognosis is excellent, which is why screening with PSA in high-risk patients is so important. If we catch a prostate cancer that's still within the prostate, whether they choose to have surgery, radiation, the cure rate is over 99% for 10 years, as long as we find it early. Treatment depends on, number one, the patient's wishes, and number two, how aggressive the cancer is. There are multiple different variables that go into deciding first whether a cancer needs to be treated. And if a cancer is very high risk, we'll be very, very aggressive, especially if the patient is very young. If it's low risk, then we'll tend to be not so aggressive and potentially just observe that cancer, and if it starts to grow, we can treat at that time. All of these treatments will have some impact on quality of life. So you have to discuss all of those with your patients and let them know what to expect after each and every treatment. And as long as it is safe, as long as I feel that that treatment is going to treat your cancer adequately, I will then tell you what are the pros and cons of each of those appropriate treatments. And then from there, it's the patient's choice. So I'll present all of the options. I'll tell them the ones that I don't think is appropriate for their cancer if it's too aggressive. I'll tell them the treatment options I think is most appropriate. And then of those options, I'll go over the pros and cons and what to expect within the first year, after the second year. What are the chances of the cancer coming back? And we make an informed decision together, and that's how we decide how you're going to be treated. Robotic surgery is an extension of laparoscopic surgery. So laparoscopic surgery is what we call keyhole surgery. Small incisions through which little ports or little holes are placed through, and we can do a big surgery on the inside of the body with small instruments and small incisions. That tends to lead to less blood loss, much earlier recovery. However, traditional laparoscopic instruments are not as facile as our hands. It's difficult to do intricate surgeries, and when we do surgeries as urologists, it tends to be in the pelvis with the prostate and the bladder, or even with the kidney and having to reconstruct the kidney, and that can be too difficult with laparoscopic instruments. What robotic surgery has done is taken the best out of open surgery and applied it to laparoscopic surgery. It's allowed these instruments to mimic the motions of my hands. So it's the best of both worlds. I can go in and do a minimally invasive procedure through small incisions, but I can also do very complex things with the robot in a very small space that I would not be able to do with traditional laparoscopic instruments. This has completely changed the way we treat prostate cancer. The prostate is located deep in the pelvis, underneath the pelvic bones, and it's very difficult to get to. When we remove the prostate, we then have to connect the bladder back to the urethra, which means a lot of suturing. And you can imagine reconnecting pipes and doing that without much vision in the open surgery. Doing that with very rudimentary instruments with laparoscopic surgery was not easy. Robotic surgery changed all of that. We can do these procedures now in under 2 hours, and the patients can go home within 24 hours, and they, for the most part, have no pain, and for the most part, don't need any narcotic pain medicine. So that's where robotics has really helped. We also use robotic surgery. We've advanced what we use robotic surgery on over the years. We do it for very complex kidney cancers. We do it for bladder cancer now. We can remove the bladder and then replace the whole bladder with pieces of intestine, all using the robot. None of this happened 10 years ago, but we're doing all of this at MedStar Georgetown now. The outcomes are patient-centered. So the patient can get back to work sooner. They have less pain. They're in the hospital for a less amount of time. They can get to their families sooner. Where this really helps with oncology and cancer surgeries is that if a patient is not just getting surgery, but they need what we call systemic therapy, like a chemotherapy or immunotherapy after surgery, they're generally recovered very quickly. So we can get them to those therapies much, much sooner when we do minimally invasive surgeries rather than open surgeries. There'll always be a place for open surgery. I still do open surgeries, and it's something that if we need to do it, we'll do it. But if we can do it robotically, we're going to do that because it's going to be better for the patient in the long term. It's called robotic surgery, but the robot is not operating on its own at all. I am in complete control of the robot the entire time. I am telling those robotic arms what to do. It's merely just an extension of my arms, letting me do more through smaller incisions. I am in complete control of the robot the entire time. So while the robot is an excellent tool, it is only as good as the surgeon operating on it. And that's why it's very important to still go to an experienced surgeon. It's not some futuristic, press a button, my surgery is done. The surgeon needs to have done hundreds of these procedures for you to get the best possible outcome. At MedStar Georgetown University Hospital, we have an extremely experienced robotic team. We have been doing hundreds of these procedures over the last 10 years. We have excellent outcomes in not only prostatectomy, but kidney surgeries, partial nephrectomy, radical nephrectomy, even advanced kidney cancer cases where we have to replace parts of blood vessels. We can do that robotically along with my colleagues in hepatobiliary surgery who are also amazing robotic surgeons. So we have some of the best robotic surgeons in the world at MedStar Georgetown University Hospital. Other than robotic prostatectomy as the main gold standard for treatment of prostate cancer, there are some less invasive procedural options for prostate cancer, and that tends to be focal therapy for prostate cancer. MRI has revolutionized the way we diagnose but also now treat prostate cancer, because if we can locate where one tumor is in the prostate, if there are no other tumors, there's a potential that we can either use freezing or high-intensity focused ultrasounds that basically burn the tumor just in that one area and potentially spare the side effects of surgery or radiation. The caveat with that is it is experimental, so it is not for every patient, and there is a possibility that cancer could come back, but we can still treat it again potentially with focal therapy, or we could do surgery or radiation after that. But that is on the horizon. I think will be in the future one of the main treatment options for prostate cancer. At MedStar Georgetown University Hospital, we are one of the only centers in the world to offer a new type of robotic prostatectomy that's called Retzius-sparing robotic prostatectomy. I've been performing the surgery for about 3 years now, and I'm one of the highest volume surgeons to do this surgery in the United States. It originated in Italy, actually, and those are the surgeons that helped me basically become good at this surgery. The reason why it's different from traditional prostatectomy is with traditional prostatectomy, you have to detach the bladder and other ligaments that pull the urethra, which is where we empty our urine out. We have to detach those ligaments from their natural places to get to the prostate. It's easier to do the surgery that way. Instead of going on top of the prostate, I go below the prostate to spare the body's natural ligaments and natural structures that preserve urinary continence. So after I do this procedure, patients get much faster return of their urinary continence and are much less likely to have issues with urinary incontinence after surgery than they would with the standard approach. And we've proven that with our own series that we've published, and we keep on putting out studies of other benefits of this surgery as well. Prostatectomy in general is done for men with cancer that is still confined within the prostate. It is not recommended that men with cancer that has spread beyond the prostate get surgical removal of the prostate or prostatectomy. We are part of a clinical trial that is looking at surgery for men with cancer that has spread outside of the prostate to see if surgery or radiation is applicable to those patients. But outside of that clinical trial, it's not standard of therapy. Like any cancer, prostate cancer can recur after treatment, but here is where PSA comes to help us again. After treatment for prostate cancer, we can use a blood test to see if that cancer has come back. Most cancers we have to use CAT scans to see if the cancer has come back, and only then we know it's come back because we can see it. With prostate cancer, if we see any elevation of the PSA after treatment, we know right away that there is a risk that the cancer has come back. And therefore, we can treat that right away with whatever therapies we may have in that situation. So while there is a risk that prostate cancer can come back, As long as the patient follows up thoroughly, we can get them more treatment to cure the cancer. And that's why overall outcomes and survival for prostate cancer remain excellent. When cancer has come back after radiation, it can be more challenging to treat that. Many of these men will just monitor them to make sure that it doesn't come back and spread. Some of these men may get debilitating hormonal therapies to keep the prostate cancer at bay. Some of these men will get cryotherapy of the prostate, which freezes the entire prostate. However, none of these are curative. It's very rare to offer surgery after radiation because the risks of incontinence as well as the overall risks of the surgery can increase. Recently, with robotic surgery, we've started to offer this option for appropriate men who have recurrence of cancer after radiation. Because of the more precise nature of the surgery, we can avoid injury to the surrounding structures, which was a big problem with open prostatectomy following radiation therapy. Also, we can decrease the risk of bleeding, but now with Retzius-sparing prostatectomy, we can also decrease the risk of incontinence. The risk of incontinence after surgery for prostate cancer that has recurred after radiation was up to 50%. Recent study that we have done has shown that that risk is less than 20% with robotic Retzius-sparing prostatectomy. So these patients have another option now, rather than just hormonal therapy or freezing the prostate, to possibly remove the prostate after the cancer comes back if they've had radiation. Prostate cancer remains the second leading cause of cancer death in men. So it is something to take seriously. It is something that we still need to screen high-risk men for, and we cannot ignore that at all. And that is because if we find the cancer early, the survivorship is excellent. These men will do very, very well, and we can avoid the potential spread of prostate cancer, which even if those men we can treat and have them survive for long periods of time, if they have to be treated with hormonal therapies or radiation therapies, or if they have cancer that's spread to their bones, their quality of life is not very good. And even if they're surviving prostate cancer for a long period of time, that's not just a number. You can't just say they're still alive. Well, they're still alive, but what is their quality of life? So while we talk about all of these survival rates, yeah, the survival rates of prostate cancer are excellent. And if we catch it early, you're going to do very well. There are some men, unfortunately, that we won't catch early, and our choices are limited for those patients. And although we can treat them and help them survive, can we help them survive in a way that they want to? Can we help them survive in a way that they remain comfortable without all of the side effects of the treatments that we're giving them? So yes, prostate cancer overall survival is excellent, but I want quality of life and living with prostate cancer to be excellent. And the only way that we can do that is by finding it early and getting these patients the appropriate treatments.